Hello, everybody, and welcome to O2 Classroom. I'm Lisa, and I'm the producer at O2 Classroom and also the content developer here at First Class Medical. We're here every Tuesday to talk about some different topics that will help you manage your respiratory condition better. Today, because it's the winter solstice, which is the longest night and shortest day of the year, we're going to talk about something that the sun affects your breathing, and that is vitamin D. So this time of year, a lot of us are deficient in vitamin D because we're not getting outside much because cold weather, and also because it's just so frantic nowadays, trying to get your gifts done and all that kind of stuff and get ready for the holidays. So sometimes we lack vitamin D. But that can be detrimental for those who are battling a lung condition. I believe it was in 2018, the Queen Mary University of London had a study that was funded by the National Institute for Health Research. And in that research, they found that the use of vitamin D supplements led to a 45% reduction in lung attacks among those with COPD who had been diagnosed with vitamin D deficiency. So we talk a lot about corticosteroids on this show and about how it can affect your bone health. So vitamin D, is essential for your bone health. But during this study, they found that it also has a role in protecting against colds, flu, asthma attacks, and it can even help with weight gain and brain development. And it also has been linked to obesity, dementia, prostate and colorectal cancers, fertility issues, multiple sclerosis, asthma, heart disease, high blood pressure, poor immunity, SAD, which is seasonal affective disorder, where you can sometimes get depression if you're not getting enough light. I know a lot of people who have that, and they have sunlight. Some are sun bulbs that they put in their rooms to sort of work with that. So it's been a link to that, as well as schizophrenia and bone aging. So what does that have to do with breathing? So in this study, they also found that it also plays an important role in respiratory health. It has an effect on lung development and structure, and also respiratory muscle strength. We've talked before about how breathing, your lungs don't move anywhere on their own. They're pushed up and down by your diaphragm, and your intercostal muscles open to allow for movement and stuff like that. So breathing is largely a muscular function. So you want to make sure you're keeping those muscles healthy. Vitamin D can also help decrease inflammation and increase immune response to respiratory pathogens in particular. Respiratory pathogens and bacteria or viruses that cause illness can be helped with vitamin D, also vitamin C, all those things that boost your immune system. In next week's show, we're going to talk about inflammation and how that works with COPD and anti-inflammatory diet. There is specifically an anti-inflammatory diet that's just general inflammation, but we're going to try to tailor some of the things that are more likely to help your lung inflammation as well. That's what we're going to talk about next week. But your respiratory tract is constantly exposed to the external environment, whether you're breathing through your nose or breathing through your mouth. All those pathogens have an easy pathway into, your lungs, your nose, anything, your sinuses. So you can easily get a cold, flu, anything like that. So we want to make sure that using vitamin D, your respiratory system is well equipped to fight off those pathogens and any kind of bacteria that may get in. So the most common source of sunlight that we talked about is the sun. If you go outside for 10 to 30 minutes a day, if it's warm enough in your area, sometimes we've talked about weather can sometimes be a, it's not jingle bells, my dog's scratching. If you go outside, and it's too cold, you can sometimes trigger an exacerbation, because when that dry air gets into your lungs, it can cause you to cough. So make sure that if you go outside to get some sun, that you're covering your mouth with either a mask or with a scarf to keep that cold air out. It can help you out. But, there's other sources of vitamin D. We've talked before on the show about supplements. If you are you're sensitive to some sort of food where you can't get it, where you can't get the vitamin nutrients that are from that particular food because it causes you, stomach problems or causes bloating or whatever, you can take supplements. It's totally fine with the direction of your doctor. But you just want to make sure that if it's possible for you to get nutrients from food, your body assimilates that much better. That's just the way our bodies are designed. But so sunlight, and we're going to name some other foods on here where you can get good sources of vitamin D. But if you have to take supplements, generally the National Institute of Health recommended 600 IUs. That's generally what's recommended, but talk to your doctor about it. IUs stands for international unit. Whereas, here in this country, we're using one source of measurement. There's a metric system in other places. So in food or in nutrients or vitamins like that, they use IU, so that the same unit is true in the UK, in Asia, and here. So if you see that you'll see that a lot on vitamins. So it'll say 600 IU. There's kind of moving away from the milligrams. It's 600 IU. So there's several foods that contain vitamin D as well. If you don't want to, do the supplements, fatty fish like tuna, mackerel, and salmon, also good in omega-3s. And we're going to talk, like I said, a little bit about anti-inflammatory diet next week. And fish is a big part of that. If you don't like fish, don't worry. We have a lot of options for you. You'll also find foods that are fortified with vitamin D. Like you'll see, some dairy products that are, extra fortified with vitamin D, or orange juice or soy milk. Cereals sometimes say they're fortified with vitamin D. So check into that. Beef liver also has a lot of vitamin D. I know sometimes people don't like liver, but it's a good source of vitamin D. Cheese, if you're not sensitive to that. Some people with respiratory condition that cause you to create mucus find that dairy products sometimes thicken the mucus or increase the production because they might have a sensitivity to that. So, just be careful there. But if you don't have a sensitivity to dairy and it doesn't help you create more mucus, cheese is a good source of vitamin D. Michelle's here. Hi, Michelle. If you have any questions, I try to keep an eye here on the comments. So if you have any questions as I go along, I'll answer them live if I can. If I need to find out the answer, I'll let you know. But I try to check through here throughout the week just to see if you have any questions, and I'll try to get them answered if I can. Another thing for vitamin D is egg yolks. So you might think about that. And I put together a list of some holiday foods, some, potluck favorites and things like that. They're good sources of vitamin D that might help you this coming week if you're thinking about adding some vitamin D to your diet. One thing is deviled eggs. Eggs have sort of gotten a bad rap about cholesterol, but they're actually pretty good for you. And they don't really raise they test high for cholesterol, but they don't actually raise your dietary cholesterol all that much if everything eaten in moderate quantities we're talking about here. Eggs only have about 75 calories, but provide 7 grams of high quality protein. Protein is important for muscle health. So respiratory muscles are good for that. They're also a good source of vitamin D as well as lutein. Lutein has been shown to protect airways from damage caused by inflammation, which is common with COPD or other chronic lung conditions. Lutein also presents a strong antioxidant effect to fight off illness. We're in the middle of cold and flu season, so that's good news too. Pudding can be good. There's a Christmas song about figgy pudding. I don't know what that is, but it doesn't have to be figgy to be good for you. Pudding is a good source of dairy, which is rich in vitamin D, but it's also a great snack and holiday dessert. Chocolate pudding sprinkled with crushed candy canes is a tasty and festive treat. Peppermint can be good for relieving some sinus problems. So, if you have candy canes, and, chocolate is a good source of a lot of different antioxidants. So try that. A cheese tray. If you bring a cheese tray, it's full of good vitamin D as well as calcium, good for your bones and things like that. And salmon. Salmon is a good main course. I know, prime rib and things like that are more popular during this time, but, salmon's a good healthy choice. 3 ounces of salmon provides a full day's requirement of vitamin D, just 3 ounces. So it's also a good source of omega-3s, which, like I said, we'll be talking about next week because it is a good anti-inflammatory. I also just wanted to remind you a few things. Sometimes during the holidays, you're more likely during this time of year from November to January. It's studies have shown that the most number of patients end up in the ER with exacerbation issues. And it's for a number of reasons. First of all, it's cold and flu season. So if you get sick, you're more likely to, end up in the hospital if it escalates into pneumonia or something like that. But also people, there's just other things that, might put you there. So I just wanted to throw out a little reminder here. It's stuff we've talked about before, but I just wanted to put them here on a list. First of all, if you're going to raise a glass, celebrate with friends. There's nothing wrong with that as long as it's in moderation. Keep in mind that alcohol sometimes reacts negatively with your medication. So, you might want to find out about that. Use some of the apps that we've talked about to find out if certain things shouldn't be used with alcohol. And like I said, keep it in moderation. One thing is also that one of the main antioxidants found in your lungs is glutathione. And glutathione can be decreased if you have too much alcohol. It decreases the production of that. So you may be more likely to get sick if you're drinking too often. So keep that in mind. While you're busy, stay hydrated. You want to keep those electrolytes up. It's going to help thin that mucus and just help your lungs work better. If you're in crowded places, wear a mask. Boost your immune system as much as you can. Margie's saying that she is right now in the hospital. Margie, we are sending you good thoughts. I hope you get out by the holidays, and I hope you're feeling much better real soon. Sorry to hear that. One other thing that you might do is make sure you're getting plenty of rest, plan ahead, and make sure that you're sticking to your medical regimen. If you're rushing around and, you get busy, it may be easy to sort of forget, to take your medication. So set an alarm on your phone if, that helps you remember, something like that. Make time for your breathing exercises, do your active cycle breathing. If you're rushing around, just take 3 minutes and sit down and do some active cycle breathing. It's going to decrease that inflammation, open up those airways a little bit, help clear out some mucus or congestion that's in there. See, Barbara is asking, I thought milk was not good for your lungs, as in cheese, yogurt, etc. Barbara, like I was saying, sometimes people have a sensitivity to dairy. And when you have a sensitivity and your body senses that something is a threat, as in something that you're allergic to, it might increase that mucus, because mucus's job in the body is to trap allergens, trap bacteria, trap pathogens, so that your body can expel it. So if you find that when you drink milk, your mucus is affected, or you eat cheese or whatever, then that's something you should avoid, or at least limit quantities of. Some people don't have that sensitivity, so when they drink milk or, if it's fine. You might want to try, if you do have a sensitivity to dairy, you could maybe try almond milk or something different like that, or soy yogurt or coconut yogurt, see if that helps you. But it's not sensitive to everybody. So just see, make sure, use your food diary as your guide. If it's something that you find has affected you ate, a tub of yogurt, and then later you felt like you had a lot of mucus, maybe that's just a red flag for you that maybe you should avoid dairy, or at least that kind of yogurt. Try coconut yogurt or some other kind, almond yogurt. Okay. And one of the other reasons why people end up in the hospital at this time of year is because they have an allergic reaction to something. Generally speaking, depending on where you live, pollen, airborne allergies aren't so high right now. But there are some hidden allergens that can be in holiday food. So I'm just going to list them here quickly. I went through, I did some research, and I just wanted to summarize them all here because I didn't really find a good article where they were sort of all listed. So I just made sort of a cohesive list. So some things that you might be allergic to in holiday cookies are wheat, nuts, dairy, and eggs. If you have any of those sensitivities, ask whoever made the cookies if it has any of those things. If you go somewhere and they have a self-basting turkey, self-basting turkeys often have soy, wheat, and dairy in them. So if you have sensitivities to that, ask. Green bean casserole might have dairy and wheat. Different sauces and salad dressings sometimes have fish, shellfish, and eggs in it, which I know sounds weird for salad dressings, but I actually did look at some of the ingredients, and some of them do have some shellfish, ingredients in there. So definitely check. Sweet potato casserole. Sweet potatoes are really good for you. They're a good source of fiber and vitamin C and all that. But sweet potato casserole can contain dairy and nuts, so just be cautious there. And any kind of pies. I had a really good pecan pie this weekend, but you might want to be careful of dairy, wheat, and nuts, depending on what kind of pie it is. So those are some cautionary warnings for you. And I hope you guys are having a great holiday. Have a very, very Merry Christmas if you celebrate Christmas. And I want to make sure that you guys are getting enough vitamin D, like we talked about. That study showed that having adequate vitamin D can decrease your chances of having a negative respiratory event by up to 40%. That's what I found in the study. So make sure you're getting outside. Make sure you're eating some of those rich vitamin D foods. If it's not dairy, it can be fatty fish. It can be a lot of other things. It can be fortified cereals. And if you can't eat cereal with milk, there's a lot of cereals that you can mix in with food. You can crush them up and mix them in with a shake, or you can even use them as a sauce, or if you're eating salad, put a little bit on the top, add a little bit of crunchiness to it. There's a lot of ways you can do it. Don't feel like just because you can't eat dairy that there, aren't ways that you can get that vitamin D. Happy holidays. I thank you guys for watching. We're coming to an end of another year of O2 Classroom, and this just gets bigger all the time. We get a lot of great questions on here. I feel like we've put out a lot of content, because of your questions that we maybe wouldn't have thought of, that a lot of people were asking about. So if you want to look at any of the former First Class Medical O2 classrooms, go to First Class Medical's Facebook page. Go to the top. You'll see a drop-down menu that says more, and you can drop down to videos, and you'll see any number of videos that we have in there. If you don't see a topic that you want to learn more about, or you want to discuss, or an issue that you're having, just message me and let me know that, you had questions about this, or you thought that this might be helpful. Thanks so much. Happy holidays again. Take care, be well, and I will see you next week. Bye.